What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery. Welcome to the Wednesday edition of the Pandemic Update for Wednesday, August 30th, 2023. If you're new to my channel, this is where we do the daily update on the pandemic with all the latest news, all the latest data. That's right, the COVID pandemic, it didn't end. It's still going on, and I got plenty of proof that it's not over today. It's a very busy news day. So stick with me here through to the end, and I will prove to you that the pandemic is not over. And if you want to see these updates regularly, subscribe to my channel down below. Alrighty, New Haven Mayor Justin Elicker. Why is he in the news today? Well, he's in the news because, well, back on January 23rd, he had COVID. But now he has COVID yet again. He tested positive back on Saturday, August 26th. We just learned about it last night is when I found the story stating that, hey, he has COVID. So this is his second time with COVID. And let's continue on here. We have to go back to the political archives here on my website. My website is datareport.info. I'm constantly always updating stuff here on the website, and hopefully I can get a lot of these past cases. There's actually a website that has past cases, but it stopped, and this is where I come into play. But speaking of past cases, yes, here's someone who has had COVID before. U.S. Senator Chris Murphy tested positive for COVID-19 on Thursday, December 1st, 2022. You're going, wait, that's in 2022. Follow with me here. Then he had COVID a second time on April 26th of 2022. Wait, that's 2022. Follow with me here. He's had COVID now a third time. Ugh, silly, isn't it? This is terrible. Chris Murphy has tested positive for COVID a third time, announcing on Wednesday, August 30th, 2023, that he tested positive after taking a test. So, yet again, more people are testing positive, and that's two political health stories. We'll have another political health story just a little bit. First, we have to get to another positive case. A John McEnroe has COVID-19. He's a tennis analyst on ESPN, and he's going to miss coverage of the U.S. Open. The U.S. Tennis Open, that's coming up, and he is going to miss coverage of that because he tested positive for COVID. Alright, we have a number of new COVID outbreaks. I think I added 7 in total yesterday. Some of them we had already reported on, but there's some of them that are new, and 2 of them that I want you to pay close attention to. This Siloam Springs restaurant, this is, I believe, in Arkansas, has shut down after staff test positive for COVID. And this outbreak, it started off, I guess, with 1 person, and then it turned out, oh, out of nowhere, 14 people that work at the restaurant tested positive. And if you actually read the story, they said, they wanted to keep the community safe, keep the rest of their staff safe. Well, it was already up to 14, and I gotta wonder, we know it can take a couple days before you actually start to show symptoms. How many already infected people who were coming to the restaurant? But this really caught my eye right here, and I added it into the archived post that I did here. The manager of the restaurant went around looking for COVID test kits, but could not find them. It actually states that in the article, the source. Like, really? You can't find COVID test kits? And it's not his fault. Not his fault at all. This is just a state at where we're at now. If there's a COVID outbreak, in some cases like this, in a rural, I don't know if this is a rural setting, but in a less populated area, we're not talking like an area like New York City, Philadelphia, or Los Angeles. We're talking like a smaller, region. You can't get COVID tests for an outbreak like this. It's ridiculous. And COVID tests need to be available for anyone who needs one and wants one and who needs to take a test. This is ridiculous. It just makes me wonder, how many cases are we missing right now because there is not adequate testing? Then we come over to this, which is also on my website. Coronavirus outbreak forces brief closure of the Vermilion Police Department. And I believe, yes, this is the website, is the Morning Journal. We did add this to our website, is what I'm trying to say. But coronavirus outbreak forces an entire police department to shut down. Now, I haven't seen any full stats like how many officers, how many people does this involve, but you're you're telling me an entire police department has to shut down? That's pretty serious. And we looked this up. This happens to be in northern Ohio, and we know Ohio is not doing so great with COVID right now. Ohio will update their COVID numbers tomorrow. All right, moving on now to this. Some sad news. This involves yet another U.S. politician, this time Senator Mitch McConnell. He had another incident today where he just froze in the middle of a press conference. He was asked a question. I believe the question had to do with re-election, possibly, or something like that. I'm not going to show the video because it is just too sad to watch, and quite frankly, that's not what we're about. I'm just not going to show you the video. I know we did last time. It's not right for me to do that because it is just too sad, and I hope he gets advised to retire pretty soon because it's just sad to see sitting senators. I mean, we have Feinstein, which is having problems. It's just sad to see this go on. I don't know. Is he diagnosed with Alzheimer's and dementia? Is he diagnosed with something? I honestly don't know. Let me know down below if you know more than I do. Then we come over to this. 5 people hospitalized in E. coli outbreak at the University of Arkansas. Just reading a headline here. And moving on to this, new, the UK rolling out COVID vaccine program a month earlier than scheduled because of new variant. And that new variant is that the BA 2.86 variant, which is super concerning. And it's something that's raising red flags all around the world. So the BA 2.86 variant is causing the UK to roll out their vaccine ahead of schedule. And we know that Zoe, which is a study there. Zoe tracks the COVID cases. They track the at-home cases and everything. Zoe right now is reporting a really high number of cases in the UK. Something like 1 million cases a day. It's just crazy what it's estimating. Whether that's actually accurate or not, I don't know. I mean, that even that does seem a little bit high, but I don't know. Speaking of BA 2.86, some more countries, let's refresh this, because there may be even more. But some more countries are now getting the BA 2.86 variant detected in wastewater, or maybe a positive case. Denmark now has a total of 10 cases. United States, 4 cases. Sweden, 4 cases. South Africa and Portugal, 2 cases. And the following countries have 1 case. Canada, Germany, Israel, Norway, Spain, Switzerland, Thailand, and the United Kingdom. There is now a total of 30 cases, so it has essentially just about doubled from our last pandemic update. This is not good. We don't want to see it starting to double, and the doubling factor is happening, and probably, if I had to guess, it's probably going to quickly go to 60, and then 120, 240. You get the idea. All right, moving on to this. This is something we like to take a look at. Hasn't updated, but it's one of our new things that we want to show you because the Biden administration started this. Heat-related illness calls. And you can see here, it is highest in the south right now, though there are a few in the north. You know, there's a few counties in the north that are seeing more calls than there should be. But in the south, it is much higher than average. In the brown and this orangish color is also higher than average as well. And you see there's a lot of brown in the south. Another state in particular that's getting hit hard right now is Illinois and the central region. That's because it has just been so terribly hot there. Let's take a look at the latest air quality values. I do have to refresh this. Hopefully it will come up quickly, but the biggest concern, here we go, it did come up quick today. The biggest concern is on the west coast at this time. But then we do have this central region. From about Texas on northward, you see a strip here of above 100. That's not good to see. And we also see up here in Canada that there is some concern. Not that bad on the east coast. Of course, Florida's not bad because you just had Idalia, or what was Hurricane Idalia. It's down to a tropical storm now, but you can see it's not too bad. The Mid-Atlantic region, some yellow. We're not going to be too concerned with that. And New England's not doing bad. If you want to learn more about climate, current weather situations that are going on, we've been talking about Adalia lately over on my other channel, and we will eventually get back to talking about the regular climate update around the country. Sometimes we share a news story of something that's going on around the world, and basically whenever there's a big storm like Adalia, we focus on that, and I probably will have an update on that again later this evening, and maybe some of the other stuff. So that's my other channel, at Climate Data Report. Walgreens did update this week, and we do know the national positivity dropped ever so slightly from 43.6 to 44.9, down 1.3%, because testing is up. 5,238 people decided to take a test at Walgreens versus 4,468 people last week. Taking a look at BioBot Analytics, this will update again later in the week. Wastewater, it has somewhat leveled off across the country, and it has dropped in the Midwest region, and it has started to show signs of dropping down in the southeast. Although, take a look at this here. It looks to me like they corrected the data, and this is new to me. I am just noticing this. So we're seeing the Midwest region continues to drop. The West Coast has leveled off. Look at the Northeast. The Northeast is continuing to rise at this time, and in the South, it is pretty much at this point has just leveled off. Now taking a look at the CDC site here, I'm going to move myself to the left for the next few segments, and you can see here on the CDC site that there's quite a few orange and red sites, which orange and red sites, that's moderate to high. That's not good. We don't like to see that. 253 orange sites, 70 red sites, and you can see a lot of them here on the map. Now let's take a look at a few of those wastewater sites that talk about other things and not just COVID. And let's just see here. Let's just randomly go around, and we'll do one today. How about we come down here to Kentucky? We have not done Kentucky in a while. And if you recall, was it last week? I think it was early last week. There were the news stories out there about illnesses ongoing in schools, and take a look at this. Coronavirus in Louisville, Kentucky at this time is on the rise, and it's actually picking up the pace. But look at this. Influenza is now starting to go on the rise ever since about August 3rd. So Louisville, Kentucky, you're starting to see flu. It's starting to go up in your area. At the same time, COVID's going up. That's not good. So I suspect the school situation there is probably going to continue a bit longer. RSV, not detected yet. HMPV, it was detected, but now it has dropped. No Mpox being detected. And norovirus, it's there, but it's at low levels at this time. And let's do another wastewater site, shall we? How about we come out here to Las Vegas? We have not checked Las Vegas in a while. Wow, the overall trajectory for COVID, it continues to rise higher. This is not good. Influenza is low at this time, and RSV is low as well. Neither are being detected. HMPV not detected. Mpox not detected. And look at this. Norovirus is actually really dropping to some really low levels at this time. Moving on now, we do know that hospital admissions, they continue to rise each week. COVID-19 hospital admissions, 15,067 in the U.S. I suspect that's going to continue because, well, you'll see in a little bit, Texas is not looking too good. And taking a look here at this map itself has not updated yet for the week. It should update later on in the week, either Thursday or first thing Friday morning. And you see a lot of orange here. The orange is substantial increases in COVID-19 detection. Alright, coming over here to the variant tracker, we should hopefully get an update on this on Friday. EG.5 is at 20.6%. FL 1.5.1 is at 13.3% at this time. New Jersey today comes in with 348 people in a hospital, 9 people on a ventilator, and drumroll please, what are the ICUs at? Wow, 47 people in the ICU. Discharges, 43 people were discharged, but here's the thing that gets to me. 348 people in the hospital, that's down ever so slightly, but 67 out of 70 hospitals reported. 3 hospitals didn't report it, so we know this number could potentially be higher in reality. Philadelphia, can move myself back to the right now. Philadelphia, 779 EMS incidents on Tuesday. Let's do a live looking at the suburbs and see what's going on. Here's Montgomery County. Not terribly concerning at this time. There's a few calls, but not terribly busy. And let's see what's going on here in Chester County. It was busy earlier, and yes, it does appear to continue to be busy now. Wow. Sick person, respiratory difficulty, stroke, diabetic emergencies, emotional disorders. There's a lot of things going on there. So it's been a busy day in Chester County, and it continues to be a busy day in Chester County. Wanted to show you this. Kathy Hochul, who's the governor of New York, has new COVID protections in New York. New York Governor Kathy Hochul announced several new protections the state is taking to protect people against the newest COVID-19 variant. And you can see here, Hochul's announcement comes as New York City Health Commissioner Ashwin Vasan, I hope I'm saying that correctly, released a statement saying that the BA 2.86 variant was almost certainly circulating in the city. And if you look here, it says New York will continue to make high-quality N95 mask test kits available to state and county officials. And, you know, obviously they're also talking about if you want to get a booster, go out and get a booster. But the main takeaway here is New York is still mentioning that people need to wear N95 masks. You know, these things right here, these lovely masks that do help prevent infection. So I wanted to bring that to your attention. I do believe I tweeted this out already. If not, I will make sure I do get it out. That way you can read this story. Speaking of New York, that's why I placed it there. Here's New York's update today. Test positive. The positivity rate, it's not great. And the number of people who did test positive, it's not great. 1,568 people tested positive. And total number of people that took a test, 10,302. That's the highest number we've seen in a while. But the positivity rate was still 14.9%. That's down slightly. The 7-day average is 14.8%. So we don't like seeing that. The number of people testing positive continues to rise. And this doesn't include reinfections or at-home tests or any of that lovely stuff. All right, speaking of New York State, now this is going to refresh on us. New York State hospitalizations, let's zoom this in so you can see it pretty well. New York State hospitalizations did drop a little bit today, 1,121. And the patients in the ICU, 108. So at least there's a tiny bit of good news on this very busy news day. And taking a look at newly reported admissions in New York State, they are a bit lower. And honestly, this is a good thing to see. Look at this. If you look at the admissions, 191. 191 is quite a drop. Was there any day last week that had 191? Okay, there were a couple days in the 180s, but if you're looking to see something rise and it starts to drop back to numbers that you saw last week, that's actually a good sign. That maybe, hopefully, it's a sign of hope that maybe this is slowing down. But we do know, with BA 2.86 being more immune evasive and just starting to circulate in tiny numbers, eventually BA 2.86 will probably cause another surge. And let's quickly just take a look at New York City. You can see New York City, again, New York City as well. Look at this. A little bit of a leveling off here. So maybe there's going to be a temporary breather before we see whatever BA 2.86 does. And as you also know, back to school is coming relatively soon. Alrighty, finally today we are going to end on the new numbers from Texas. We're not going to do the international update today. We have thrown a lot of information and news at you. We will try and get an international update in tomorrow, but who knows? Maybe it'll be another busy news day. I mean, this wave just continues. Taking a look at Texas. Texas, it's not good. They've added another 26,504 cases last week. The previous week was 20,133. That is up 6,371. And you're probably saying, well, wait a second. They used to have tens of thousands in a day back in BA.1 and other times. I get that. They did. But here's the thing. This is during the time where we have much less testing, where people are not getting tested. So we know if they added 26,504 cases last week, that number is likely tripled, quadrupled, whatever. It's likely a much higher number. I mean, here's where the number of cases are reported this week. The actual number is probably way up here somewhere. Yeah, it's probably a number that's likely much higher. And here's something else that's relatively concerning. Last week, they had 19 deaths. Okay. This week, 37 deaths. That's up by 18. It almost nearly doubled. Number of people in the hospital, that rose quite a bit too. That's up by 142. Last week it was 1,096. This week it's 1,238. So the number of people in the hospital is going up as well. Alrighty, my friends, that does it for today's pandemic update. I know I threw a lot of news and data at you. It's just a crazy news day, and I suspect we'll probably find some more bad news out tonight. If there is any positive, take that little bit of a breather that may be happening in New York State. And you know what, my friends? Just hope for the best. We're all in this together. I hope things will eventually turn around. And maybe one day, maybe we'll be doing updates on something else and not have to talk about COVID anymore. But here we are. I'm not going away. I will continue to do these updates. If you enjoy these updates or enjoy this video, give it a thumbs up. If I have convinced you, if you're new to my channel and I have convinced you that the pandemic is not over and you want to see more updates like this, by all means, subscribe to my channel down below. If you know anyone else that needs a convincing that the pandemic is not over, by all means, share this with them. I would love to try and convince them and hopefully help keep them safe. Alrighty, folks, I'll see you all again next time. But until I see you again next time, stay safe, everyone, and have a great Wednesday evening.